a local line. The structures which are located in the posterior triangle are two parts of the structure: superficial structure and deep structures. What are the superficial structure? The superficial fascia, okay, and the structures in the superficial fascia like platysma muscle, like
internal jugular
hypothalamus branch,
of cervical.
okay, and then we arrive to deep structure. The deep structure are located in the fascia investing, and also are located in the another part of the deep fascia. There is an exception in this area. This exception is external jugular vein. What do you think about external jugular vein in the posterior triangle? It is a superficial structure or a deep structure?
Deep structure.
No, it is a deep structure. Why? Because I said that external jugular vein is located anterior or superficial to the SCM. So, in the SCM area, it is a superficial structure. But when
Just
it
not a
arrives to the supraclavicular triangle, in this area, it pierces the deep fascia to insert subclavian vein. So in this area, it is a deep structure. Okay. Another structure in this area are the muscles which these muscles make the floor of the posterior triangle. What is the roof of posterior triangle?
Investing
Yes,
layer.
investing layer. Investing fascia is the roof of the posterior triangle. Floor of posterior triangle are the muscles in this area, which these muscles are scalenus muscles,
Splenius capitis.
splenius capitis, and between splenius capitis and scalenus muscle we have levator scapularis. Okay. The scalenus muscles are three parts: anterior scalenus, posterior scalenus, and middle scalenus muscle. As you can see this area, anterior scalenus muscle. You remember this number for better and easy memorizing for the innervation and origin of this muscle. You remember the 36, okay, and 46. 36 and 46. What are 36 and 46? The origin of anterior scalenus muscle are the anterior tubercle of the transverse process of the cervical vertebra, number 3
to 6.
to 6. 36. Number 3 to 6. What is the innervation of this muscle? The innervation is the spinal
4 to 6.
is the spinal nerve 46. Number 4 to 6. Okay? 36, 46. Middle scalene. The middle scalenus muscle. So the function of anterior scalene. What is the function of anterior scalene? What do you think?
So what is the insertion from after anterior?
Its insertion of anterior scalene is the first strip, is the superior surface of first strip in the scalenus tubercle. Do you remember the scalenus tubercle?
Yes.
Yes. The scalenus tubercle which is located in the superior surface of first rib, and it is the site for inserting the anterior scalenus muscle. So, the function is
Routine.
the lateral rotation. Lateral rotation of the head and neck. Lateral rotation of head and neck is the function of scalenus anterior. Middle scalene is a large muscle, which, what is the origin and insertion of middle scalene? You read the insertion of middle scalene in the thoracic area. Okay, the first rib, remember the first rib has a scalenus tubercle, and posterior to scalenus tubercle has this insertion of middle scalenus muscle. Do you remember? No? The first rib at the superior surface has a tubercle which is named scalenus tubercle. This tubercle is the site for inserting anterior scalene. And posterior to scalene tubercle is the site for inserting middle scalenus muscle. Middle scalenus muscle is a big muscle which originates from all of the transverse cervical vertebra, and its function is it is the function of the all scalenus muscle are the lateral. Yes, lateral rotation of the muscle. If the muscles of the right side constrict, we have the lateral
Right
rotation
flexion.
from the same side. Okay? It is the function.
side.
And the innervation is C3 to C8. C3 to C8. Posterior scalenus muscle is a small muscle which originated from 46. I said that you remember 36 and 46. Originated from C4 to C6 transverse process of cervical vertebra, and its insertion is
6 to 8.
lateral side of the second rib. Lateral side of the second rib. It is the insertion of the posterior scalenus muscle. The posterior scalene and anterior scalene.
Innervation.
What?
Innervation of posterior.
The innervation of posterior scalene is also from C6 to C8. C6 to C8. Okay. These two muscles, anterior and middle, are very important because an important structure is located between anterior and posterior. Okay? See here. What is this plexus? It is cervical. Brachial.
Brachial plexus.
Yes. It is brachial plexus. Brachial plexus originated from C5 to T1. Yes,
Yes, sir.
C5 to T1. So, all these roots are located between anterior and middle scalenus muscle. Anterior and middle scalenus muscle. Also, what is this artery?
Axillary.
Subclavian artery. Also subclavian artery traveling between anterior and middle scalenus muscle. So, we divided the subclavian artery in three parts. According to anterior scalenus muscle, first part, second part, it is just posterior to this muscle, and here, third part, It is after the anterior
Scalenus
scalenus
muscle.
muscle. Another muscle is levator scapula. The levator scapula originated from C1 to
C4.
C4 transverse process of cervical vertebra. Okay? And its insertion, as you can see,
Medial border scapula.
is the superior border near the superior angle of the scapula and also the root of the acromial process. Also, the root of the acromial process is the insertion. What is the innervation of levator scapula?
Accessory spinal. Spinal accessory.
No. Look at the slide. Levator scapula is innervated totally by dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve is a branch of
Cervical plexus.
no brachial plexus. Brachial plexus. The first root of brachial plexus made the dorsal scapular nerve.
Yes, sir.
Also, C5 and C4 made some innervation for this muscle. But the total innervation is by
Dorsal.
dorsal scapular nerve. What is the function of levator scapula? If
Yeah,
the
elevation of scapula.
is fixed, if the scapula is fixed, okay, it can make the posterior flexion of the head But if the head is fixed, if the cervical vertebra and the head is fixed, it can
Elevate scapula.
elevate the scapula. Okay, it is the function of levator scapula.
If scapula is fixed, what's the function?
What?
If scapula is fixed, what is the function of levator?
If the scapula is fixed, originate from the transfer process of the cervical
C1 to
vertebra.
C4.
Okay, if it is fixed, it can some part flex the head to the lateral. If a lateral part is constricted, okay, it may dysfunction. Okay, lateral and posterior flexion. But if two muscles of bilateral are constricted, they may. What is this function?
Meet, sir.
What is this function? Retraction? Yes,
Yeah,
retraction of the head and some depression. Some depression of the head. Okay? Splenius capitis. Splenius capitis is located posterior to levator scapula. Posterior to levator scapula. Splenius capitis originated from nuchal ligament. Nuchal ligament is a ligament which connected the transverse process of the cervical vertebra together. Okay? Nuchal ligament. It originates from nuchal ligament and also from spinous process of T1 to T4. T is thoracic 1 and thoracic until thoracic 4 spinous process. Okay? And this muscle travels superiorly to attach to the superior nuchal line. Attach to superior nuchal line. Okay? What is the function of splenius capitis? What do you think about the function of splenius capitis?
Rotation. Lateral rotation.
It is originated from the spinous process and nuchal lines. Okay, and insert in this area. So, if this muscle bilaterally is flexed, it may retraction. Yes, retraction of the head. And this muscle is located in the posterior part and deep, posterior and deep part of the cervical area. And as you know, the muscles of the back are divided into intrinsic muscle and extrinsic muscle. Intrinsic muscle are innervated by posterior rami of the spinal nerve. Extrinsic muscle are innervated by anterior ramus of the spinal nerve. So, this muscle, sphenius capitis, is innervated by the posterior ramus of the spinal nerve from this area. C2, C3, C4, okay? Subclavian artery. You should know the subclavian artery and its branch. Okay? Okay?
Yes, sir.
Yes? Are you awake? No. Okay. Subclavian artery is divided in three parts according to the insertion of anterior scalenus muscle. The first part is located medial to the anterior scalenus muscle. Second part is located posterior to the anterior scalenus muscle. The third part is located lateral to the anterior scalenus muscle and its branch. All of the branch of the subclavian artery, all of the branch of the subclavian artery from left side are derived from the first part, except of dorsal scapular artery. Okay? From left side, all the branch of the subclavian artery are derived from the first part, except of dorsal scapular artery. Which dorsal scapular artery in the left and in the right is derived from the third part of this artery. Okay? In the right side, all the branch are derived from the first part, except of two branch. One of them is dorsal scapular, like the left side. One of them is dorsal scapular, which derived from the third part, and another branch is costocervical trunk. Costocervical trunk is derived in the second part, just posterior to the anterior scalenus muscle. Okay? This exception is for the branch of the subclavian artery. So, the first branch. Yeah, I said that a branch is derived from the third part in right and left. It is dorsal scapular. Okay. In the left side, all of the another branch are from first. In the right, we have another exception again. Posterior to the anterior scalenus muscle, we have costocervical trunk. But the branch. In the first part, the first branch is vertebral artery. Vertebral artery. See the vertebral artery. The vertebral artery travels superiorly to insert to the transverse foramen. In the cervical vertebra, we have transverse foramen. Yes. It inserts to the transverse foramen of C6. And travels superiorly to insert to the foramen magnum. When it inserts to the foramen magnum, insert to the brain. And when during inserted to the brain, this vertebral artery from right and left connected together to make basilar artery. basilar artery is located anterior to the pons, in the basilar sulcus of the pons. So, it was the first branch, vertebral artery. The second branch is here. It is derived from the inferior surface. What is this branch?
Internal thoracic.
You are weak in the thorax. You pass the thorax, yes?
Internal thoracic.
Internal thoracic, yes. Internal thoracic artery, which travel near the phrenic nerve, posterior to the costal bridge, until arrive to the sixth intercostal space.
Spaces.
In the
Muscle.
sixth intercostal space is divided in
Two.
two branches. Which branch? Superior epigastric and musculophrenic artery. Okay? Okay?
Yes,
Okay.
sir.
So, at the level of internal thoracic artery, we have thyrocervical trunk.
Sir, will you repeat the path of the vertebral artery?
Trunk is derived at the level of internal thoracic artery. Okay? At the level of internal thoracic artery. The branch of the thyrocervical, the most important branch is inferior thyroid artery. Do you remember the superior thyroid artery? Superior thyroid artery is a branch of external carotid artery. Okay. Inferior thyroid artery is a branch of thyrocervical, which supply the thyroid gland. The inferior thyroid artery travel just near the external laryngeal nerve. During the surgery of thyroidectomy, you should be away from this adjacency of the inferior thyroid artery and external laryngeal vein. Okay? When this artery near to the lobes of the thyroid gland, it's separated from the nerve. So, where is the safe area for the cutting of this artery during removing of the thyroid gland, thyroidectomy? The safe area is just near to the thyroid lobe, because near to the thyroid lobe, the artery and nerve separated from each other. So, another branch, as we can see here, see these two branch, transverse cervical and suprascapular. Yes? Transverse cervical and suprascapular artery. These two arteries crosses with the anterior scalenus. Here is anterior scalenus nerve. These two arteries crosses with the anterior scalenus nerve and also with the phrenic nerve. Phrenic nerve passes in the anterior surface of anterior scalenus nerve, and it crosses with these two arteries, with suprascapular artery and transverse cervical artery. They are the branch of the cross. See here. Here we have, let me